Welcome to Journal of Cardiac Failure's YouTube channel.
Heart function, not failure.
Heart success.
Mentorship.
Unwed matters.
We care.
We hope you enjoy the episode.
Hi, and welcome to the next installment of the JCF YouTube channel. It is really an honor today to talk through an important paper that just came out in the Journal of Cardiac Failure, entitled Sex Differences in Heart Failure. And it is my privilege today to have a number of the authors from that paper. So without further ado, let's jump right into this important discussion. Dr. Lala, maybe we'll start with you. Give us a little bit of background on the rationale of why you all decided to proceed with this very important paper.
Thanks so much, Rob. It's so fun to be here for our second YouTube channel episode focused on sex differences in heart failure. I think what was really exciting about this paper was that I had the good fortune of finally getting to know someone I'd fangirled for a while, Martha Gulati, who is a leader in this space, as we all know. I think we all fangirl her here on this call. And given JCF's very clear goal of focusing on diversity, equity, inclusion, and belonging, and wanting to highlight the research and the gaps in knowledge in this space, Martha and I were talking after one of our editorial board meetings about how nice it would be to put forth a really sort of up-to-date summary on sex differences in heart failure with a specific goal of highlighting the gaps in knowledge. And it was really important for us to assemble a group of just really diverse, enthusiastic clinicians across the board, across the globe, as you can see with Paz here as well. And I think that was one of the most rewarding aspects of coming together for this piece, is that we had men, women across race, across ethnicity, across the globe, as I already mentioned, coming together really with the intention of putting together a comprehensive document that summarizes these differences and really highlights the gaps in knowledge to date.
Anu beautifully stated about some of the rationale and putting together really an all-star cast that'll help really frame these important points for our readership. Martha, maybe a question for you. As you now had some time to really process all this and convey this important message, what are some of the risk factors that really strongly predispose women to heart failure as compared with men?
Yeah, such a great question, Rob. I think that, understanding the biological differences and risk factors for all forms of cardiovascular disease is really important. And for heart failure, I think somehow we've ignored this for a very long time. For example, diabetes, more prevalent in women than in men, but also such a strong risk factor for heart failure. In fact, you're more likely to get heart failure than you are to get coronary artery disease. And I think the community just in general underestimates this. But even there, with that, there's biological differences, things that are happening for biological women that don't always happen for biological men. So understanding that, I think diabetes is one of the big ones. I mean, that one predisposes diabetic women to more cardiovascular events than it does for men. And we don't really know exactly why that happens, but there's obviously, we dive into it in our paper trying to, what are the potential hypotheses. Additionally, even risk factors like obesity, I think, are really important for us to understand how biologically it differs for women in terms of predisposing them to heart failure. And I think identifying risk factors that are somehow different is really important because it's a target. I'm a preventive cardiologist, not a heart failure doctor, and I'm always thinking, what can I do for my patients to try to prevent any form of cardiovascular disease? And if we don't identify these sex differences, maybe we won't attack them in the same sense of urgency.
Martha, just beautifully stated. I think so many pearls that you've highlighted for our listeners. Maybe transitioning a little bit, Corrine, why do women tend to present it with more severe disease as compared with men?
That's a really great question, and honestly, something that remains
to be elucidated at this point. It's possible that women often present later on in their disease trajectory, and as a result, are much more severe once we do recognize that they have heart failure. Certainly with EF cutoffs as they currently stand, there's a difference in the sense that women will often present with heart failure symptoms at a higher EF, so they're in turn under-recognized. And also traditional risk factors for heart failure, such as hypertension, occur more frequently in women. And as Dr. Gulati mentioned, we really should all be in the business of prevention. And the best way to do that is by recognizing risk factors for the development of heart failure, particularly the risk factors that women are more vulnerable to. And then in doing so, be able to interject early and in doing so mitigate the poor outcomes that we see.
Corinne, really nicely stated. An important reminder to look early and think about this often. Maybe on a little bit of a different note, it'd be great to hear some of your reflections in line with the core values at JCF around promoting the next generation and mentorship. What was it like to participate as a fellow in this piece, and maybe share a little bit about the guidance that you gave us on the visual appeal and the strategy to make this document memorable for the readers?
Absolutely. So talk about a fangirl moment, being able to participate in a document with leaders in the field that I have always admired and looked up to. I think these processes, as they usually are, these documents take multiple iterations, and each iteration of the document was a learning process in and of itself, because you really get to see how all of these different thought leaders see the current problem as it stands, which is the issue of sex differences in heart failure. And so it's really been a wonderful opportunity not only to learn different writing styles, different perspectives, to be able to network. And so I'm incredibly grateful to have been able to be a part of this process. And then in regards to the visuals, I personally am a very visual learner and love, colors. I think that's what really grabs the attention of the audience, especially now with so much learning that's done through social media. I think we all recognize that the ability to sort of capture a lot of pearls within one graphic can have an incredible impact on individuals worldwide, because that's really sort of the snapshot that people are able to take away from such an important document as this. And so I tried to, in working on these graphics with the team, tried to not only make sure that I was putting in the information that was important, but also making it fun and, something that I knew would be sort of referenced and people would be able to look at in the future.
Beautifully stated. Thank you so much for all the contributions on this. Maybe just a couple last questions with our remaining time. Paz, maybe we'll turn to you. What do you think has really stood in the way of improving heart failure diagnosis and treatment among women?
Thanks, Rob. Thanks. Great question. I think Corinne really alluded to it in her last answer, which is our understanding of heart function in women is limited. Although appearances are that men's and women's hearts are the same, we know that is not true. And women, certainly in presentation, have a very different form of heart failure. And generally, women tend to present with higher left ventricular ejection fractions, but are no less symptomatic. So it starts to pose the question, are we really underdiagnosing impaired contractility in women? Or are we diagnosing it in the right way? And are we over-reliant on a small subset of markers and missing the bigger picture? We use LVEF all the time. It's convenient. It's great. But at the moment, we use sex-neutral cutoffs for diagnosis. And we don't know, for example, if that's appropriate, because we know that even in health, men and women have very different ejection fractions, even in health. So why wouldn't that be propagated to disease? And these are some of the really fundamental questions in our field. And I think until we start to tackle them, we won't improve how we can diagnose heart failure in women. And I think that the other side of that coin is I think we need a better understanding of the whole heart failure symptom profile in women. So we know what the classical symptoms are, but we don't know whether there are other symptoms that women are presenting with that actually are currently being misdiagnosed.
Thank you for that really nice summary. Maybe in closing, Anu, we'll turn to you. So what are the immediate next steps that need to be taken to really move the needle on the care for women with heart failure?
Thanks, Rob. I just want to give Paz a little kudos there. I like that you spoke about heart function. I really think, people have heard us talk about this perhaps ad nauseum, but I don't think it can be overemphasized. I think the way we communicate about disease, in this case, heart failure, really impacts how patients receive information and how they may or may not feel empowered to participate in their own care. And I do believe speaking about function rather than failure is a part of this. In terms of actionable items that we tried to outline, as others have as well, but for the purposes of this document, I think the consideration of evidence-based guidelines for men and women separately is something that we should really, really think about. And before we perhaps need to do that, clearly there's a need for us to discover more, understand more. I think there's definitely a need to involve women in clinical trials more, both on the leadership side, so women as in charge of clinical trials or oversight on the steering committees, but then also that would lead to a greater inclusion and greater representation of women in those clinical studies. I think for the future, we also want to partner with funding agencies, both public and private sector, for really sponsoring research, identifying sex differences in the prevention, as Corinne mentioned and Martha mentioned, and the treatment of heart failure. So I think there are, we sort of love our last central figure, which is this call to action. So we'd encourage our viewers to check it out. But I think it's exciting also, I'm an optimist, to see that we are moving the needle. I think conversations like this, pieces like this, publications like this, forums like JCF are really recognizing the need to spend the time and effort in better understanding the sex differences between men and women. And I'm just very grateful to be a part of this movement. So thanks so much.
So thank you all so much for joining. This has just been a phenomenal discussion. Again, make sure you check out the article in the Journal of Cardiac Failure, Sex Differences in Heart Failure. The link is in the bottom of this chat box as well. So again, thanks everybody for joining. Thanks to all of our guests. Congratulations on this important piece, and let's continue this march forward on important change in this space. Have a great day.